look in the mirror, what do you see when you look in the mirror? Do you see a beautiful human being or an ugly creature? Do you see yourself or do you see someone else in the mirror? If you are seeing a distorted image of yourself in the mirror, then you may be experiencing symptoms of a disease called body dysmorphic disorder. An example of someone who has body dysmorphic disorder is Pamela. From True Life, I Hate My Face. Pamela exhibited many symptoms of someone with B.D.D. She was very obsessive with her nose and tried everything to hide her ugly nose. After watching the show, I was very concerned with people who had B.D.D. and was very upset with how media has portrayed people's attractiveness. After watching the episode, I wanted to learn more and became very interested with B.D.D. And the purpose of my speech is to raise awareness for body dysmorphic disorder by explaining what is B.D.D., the possible symptoms, and how to treat the disease. Many people have seen someone with B.D.D. but aren't familiar with the term. Body dysmorphic disorder is a mental illness that results in someone becoming compulsively obsessive with a certain flaw in their appearance. B.D.D. leads to a distorted image of oneself, which results in trying to fix a flaw that they will never be satisfied with. Who is susceptible to B.D.D.? People with personality problems, people that are narcissists, perfectionists, people who seek attention, who crave to be belonged, are very insecure, schizophrenics, introverts, people with OCD. And according to Catherine Phillips, 20% of patients with B.D.D's parents also have B.D.D., so it's also hereditary. A chemical imbalance in the brain could also cause someone to have B.D.D. Or it could be life experiences, like if your mother always wanted you to look a certain way and put a lot of emphasis on your appearance, or even having being neglected, having a sexual trauma could result in someone with B.D.D. 60% of children that were teased about their appearance in school also had B.D.D. And the media also puts a lot of emphasis on being very attractive. And the symptoms, and according to Dr. Catherine Phillips, author of The Broken Mirror, people with B.D.D. exhibit numerous symptoms of low self-esteem. They're very obsessed with their skin, 73%. 56% were obsessed with their hair, 55% their weight, and 37% their nose. Just like Pamela on True Life, this is how she saw herself in the mirror. This is what she actually looked like. People with B.D.D. try to mask their imperfections, just like Pamela. Like they try and put a lot of makeup on, cover up their faces. They like to wear a lot of clothes, fancy clothes, just anything to distract whatever flaw they feel they have with themselves. They have mental problems. They're constantly working on their appearance, constantly grooming themselves. Some of them have alcohol or drug abuse. They always need constant praise from others. They always need someone to tell them how good they look or they're not ugly. And some of them become depressed. They have suicidal thoughts. They have a lot of anxiety. They're constantly wanting plastic surgery, just anything to try and fix their face or their hair or their body or whatever it is they think that everyone else is just constantly looking at, and that they can't even, they have social problems. They try not to be around a lot of people at once. Just like on the show True Life, Pamela said that she thought she was too ugly to be out in public. She didn't want anyone to see her. But there are treatments for B.D.D. Although B.D.D. is a mental illness, it can be controlled or ultimately eliminated with the proper treatment. Some try and get plastic surgery, which only temporarily fixes their problem. Like Pamela, she thought she had a nose problem, so she went and got her nose done, and then she felt better about herself and thought she had all this self-esteem for a couple months, and then she finally realized that she still had problems with her nose, and she wanted to get other plastic surgeries, and she still was never comfortable with herself. 53% of the people received medication. It helped fix their BDD. 74% it helped getting therapy, but the best treatment for BDD is cognitive behavior therapy and medications such as Prozac. Together it helped 82% of patients with the follow-up treatments. Many people aren't properly diagnosed with BDD, but after my speech, I hope you all will now be able to understand what is body dysmorphic disorder by noticing the signs and the possible treatments.